Good afternoon. As Chris had said, I'm Debbie Larson with EHP and the League. And remember that a link for full bios for all speakers is posted in the chat. The first panel will discuss novel methods for assessing air exposure and public health. And our framing panelist is Dr. Nicole Deziel. Dr. Deziel is an associate professor in environmental health sciences at the Yale School of Public Health and a member of the Yale Cancer Center and Yale Center for Perinatal, Pediatric, and Environmental Epidemiology. Her research involves combining existing and advanced statistical models, biomonitoring techniques, and environmental measurements to provide more comprehensive and quantitative assessments of exposure to legacy and emerging contaminants. For the past 5 years, Dr. Deziel has been leading research into potential environmental exposures and human health impacts of the unconventional oil and gas industry, evaluating issues related to water pollution, labor migration, and environmental justice. Dr. Deziel?
Okay, wonderful. Well, thank you so much to the League of Women Voters and to Heather for putting on this conference, again, the eighth one. It's really a great pleasure to be here. Also want to thank all the organizers and the technical experts and as well as the Technical Advisory Committee, which I had the pleasure of chairing this year. And it was great to work with these leading researchers in the field to help Heather put together this slate of speakers. And I hope that judging by the overwhelming number of participants, that the audience is as excited as I am to hear about the latest science in relation to shale and public health. So the first topic area that we'll be covering today is related to exposure assessment. And this is very exciting for me because I am an exposure scientist. That is my primary area of expertise. And it doesn't always get a lot of publicity or attention, but it is extremely important for conducting these health studies. So I'm just going to take about 10 minutes to give an overview of the types of exposure assessment approaches that researchers have been using in their health research and kind of reflect on where we've come and where we're going. And then we'll be hearing from some of the speakers doing leading edge science in this area. Okay, so I thought I'd start by getting us, all on the same page. I know this is quite a mixed audience, so I know many of you are very well familiar with this type of paradigm, but this is our overarching paradigm that we use in environmental health, where we're really trying to understand kind of the extremes. Do certain pollutant sources or industries like the unconventional oil and gas industry, are they associated with various health outcomes? And many aspects of our research is trying to elucidate kind of all of these different steps along this exposure to disease pathway. And the more we can nail down kind of these incremental steps, the more we can strengthen our evidence base and understand these patterns that we might see. And they can also offer opportunities for interventions or mitigation strategies. And so this cartoon below really shows what what many of us are aiming to achieve with our research. We're trying to understand whether these unconventional oil and gas, either emissions or activities, are ultimately leading to exposures and health outcomes, and trying to understand, what's being released, how is it making its way through the environment, through the air or water or soil? Is it actually leading to some sort of increased exposures in nearby residents and communities? And are these exposures triggering health effects or different various symptoms or health problems? Okay, and when we talk about kind of the sources or exposures, there's really many that could be resulting from this industry, many that have been addressed in the literature, things like air pollutants, water contamination, but also traffic accidents, earthquakes and seismic activity, traffic, light, noise, stress. So there can be many different things that we're trying to capture when we're trying to assess exposure to unconventional oil and gas. So many of the health studies, well, all health studies use exposure surrogates. We can't go out and measure, all of these different things at every place at every time. So we have to rely on what we call exposure surrogates. And generally, these have been some sort of proximity-based metric to try to capture how close people are to many oil and gas wells. So it could be something like distance to the nearest well, how close is the nearest oil and gas well to a study subject's home. There have also been these inverse distance weighted metrics where we know where a study subject lives and we can draw a buffer around their home and count up how many wells are in this area, and we can give more weight to ones that are closer. Other metrics like those coming out of Johns Hopkins group, Brian Schwartz, Joan Casey, have built on this simpler metric to incorporate other information about oil and gas well attributes like the production volume or the depth of the well to try to better discriminate or differentiate between the different wells and the types of emissions they might be yielding. So I wanted to talk a little bit more about why we do use these surrogates and why exposure assessment is really quite a challenging endeavor. One is that, and I'm going to walk through all these in just a little bit of detail, but we don't always know what exposures or etiologic agents we want to measure. Second, the whole exposure circumstance, all those steps that I laid out, may be complex. Also, many of the studies that have been done are registry-based studies using birth certificates or cancer registries and trying to reconstruct exposures that occurred in the past. And so, we may need to cover long periods of time. And measurements are hard to get, especially for a population-based study. It's expensive, it requires a lot of resources, a lot of equipment, so that can be challenging. And there are publicly available measurements or data. Sometimes they're not where you want them or when you want them, and they might not be capturing exactly what you want, but those can be available as well. So just to give some examples of each of these, this was some work that came out of my group. Elise Elliott was my doctoral student. In the very beginning, when we were going out to try to do some measurements, we were faced with what to measure. And there were over 1,000 chemicals that were linked to the unconventional oil and gas industry, either in the fracturing fluids or mobilized in the wastewater or emitted from air pollution. Of course, not 1,000 all at once from any given well, but 1,000 possibilities. And it took us a while to figure out, how do we prioritize this list? So one idea is you could prioritize it based on just looking at chemicals that are known toxicants, for example. And this was an analysis we did where we found actually, many of the chemicals had no toxicity data that was relevant to our outcome. Also, this whole exposure circumstance may be complex. Is it, are we concerned about air pollutants that are continuously emitted, or with water pollution, which is something I'm interested in. Something generally it's a little more episodic. There has to be some sort of leak or blowout or spill or something like that, which is very difficult to predict and kind of follow. So that makes things challenging. And then are we interested in surface water or groundwater, things like that. And as I alluded to before, sometimes, we can't just go out and measure things now. We have to use these surrogates because we're trying to reconstruct exposure sometimes many years in the past. So, often if we're here, researchers doing studies now, we're gathering birth certificates, we're gathering cancer data. The cancer diagnosis may have occurred 5 years ago, 10 years ago. The births may have occurred over the past decade. And so the window of exposure that we're trying to estimate may be many years prior. And we could collect the best, most detailed measurements now, but it may not capture, the time period that we're really most interested in. So surrogates can really play a role here. Measurements are difficult to obtain. As I said, if we wanted to measure, dozens of chemicals in the water, you need different sampling equipment and bottles and preservatives and filtering methods. Do you want to look at metals? Do you want to look at volatiles? Do you want to look at methane? All of these require different resources and technologies to collect and then measure in the laboratory. Of course, we need the cooperation and consent of the community members and participants. And it's challenging work. And now more than ever, as we're trying to do these measurements in a pandemic, just adding another challenge to this. And in any case, though, this type of detailed work is really not feasible if you're looking at thousands of subjects, thousands of births, over many years. It's just not really possible to do such work, or it would be extremely expensive. And then, there are some publicly available data sets. I hear this a lot, why don't you just use this or that data set? But, to do really good work, you need it at the right spatial resolution, temporal resolution, and sometimes it's just not exactly appropriate for the research question. However, we're going to be hearing from some people who are making very creative use of new existing data sets. So that's exciting. Okay, so just to kind of give an overview or summary of some of the things I've covered here, these types of proximity-based metrics have both strengths and limitations. So some of the strengths are that these types of surrogates are really useful when you have large population studies because they're highly scalable over large geographic areas. They're also useful if you're trying to reconstruct exposure back in time. And they are relatively inexpensive compared to going out and collecting measurements. And you can think of this as an advantage in that it's by looking at proximity to oil and gas wells, excuse me, it's really an aggregate measure of all of those different potential stressors that I illustrated in my word cloud in the very beginning. So it doesn't require you to know, well, is it the earthquakes? Is it the metals? Is it the air? Is it the water? You can kind of look at the industry in aggregate, and that can be very valuable. This can also be these metrics can be interpretable and useful for policy. So again, maybe we don't need to disentangle what element of the industry might be leading to increases in health problems if we just know that women who live within a certain distance for oil and gas wells are more likely to have preterm births. Maybe we don't need to sort out all the details. We don't need to take some sort of action, and these kind of metrics kind of lend themselves to buffer zones and other types of policy options that we have. On the flip side, some of these limitations are that it doesn't identify what it is about the oil and gas industry that could be underlying or underscoring these health outcomes we're seeing. So this makes it difficult in terms of mitigation strategies. It would also strengthen the science to really be able to pin down kind of what exposures might be underlying these associations. And another limitation is most of the metrics to date don't always account for directional dispersion. So you could be living very close to a well, but if the wind is blowing completely in the other direction, proximity alone may not be a good surrogate. But we're going to hear from some folks also moving us forward from this, moving us away or overcoming some of these limitations. So I just wanted to highlight a few researchers. This is by no means a complete list, but many of the speakers today are really pushing the field forward. And I'm really I think it's pretty remarkable that this field is still pretty nascent. We haven't been. I think the first health study was, in 2014, and that's not that long ago. We're already making some powerful advances in the exposure assessment approaches. So some of the newer methods are considering directional dispersion, which way are pollutants, moving once they're emitted. They are trying to get more specific information about which exposures or stressors could be underlying observed patterns. Many researchers are incorporating more information about the oil and gas wells themselves and their attributes into these metrics to add more detail and discriminate between different wells. And many people are also leveraging really innovative data sets like satellite data. And I'll just highlight a few here. Lisa McKenzie and Ben Alshouse developed this. This is a lot more complex than the first model I showed, just the inverse distance weighted metric, where they incorporated emission data and other pieces of information. Here we're gonna hear from Kathy Tran, I believe, in a different session about some of their work looking at not just proximity, but also oil, barrels of oil, like volume of production and their metrics. Be hearing about people using satellite data and flaring as another to try to push this field forward. Directional dispersion and other information here, trying to determine wind and other distributions of pollutants. And this is an example from my work with water, where you can have multiple oil and gas wells that of a similar distance, but if the water flow is kind of away from your drinking water well, some oil and gas wells may not be contributing or very unlikely to contribute to exposure at all. So these are just some examples of research we'll be hearing about in this conference, or that's available in the published literature that is moving the metrics forward. So to summarize, these spatial surrogates were certainly a very useful and appropriate starting point for assessing exposure to this complex industry. We are moving on with improvements by incorporating dispersion factors and other information, which really can help us improve our exposure assessments, which strengthen our scientific knowledge base and can provide insights and information about mitigation strategies. So with that, I'd like to conclude my framing remarks, and I believe we're turning it over to the first speaker of the panel.